All right, we're going over some more painted bones. So this is an os coxa, and we can tell that this is the right hip bone because we can see the acetabulum pointing laterally towards the right. So going over some of the origins now. On this posterior side, we can see on this posterior ilium to the posterior gluteal line, we have the origin for gluteus maximus. From the in between the posterior and anterior gluteal line, we have the origin for gluteus medius, and in between the anterior and inferior gluteal line, origin for gluteus minimus. Right here on this anterior iliac spine, anterior superior iliac spine, and kind of wrapping around, we have the origin for the tensor fasciae latae, TFL. Also on the ASIS, we have the origin for sartorius. Flipping around here in this iliac fossa, we have the origin for the iliacus. Right here on this medial portion of the iliac crest, we have the origin for the erector spinae. Looking laterally now, we have the two origins for the rectus femoris, one on this superior lip of the acetabulum, and another one on the anterior inferior iliac spine. Let's look anteriorly again. Right on this inside, on this interior lip of the obturator foramen, we have the origin for obturator internus. And then if we look over here on this exterior lip of the obturator foramen, we have the origin for obturator externus. Right here on this pectineal line, we have the origin for the pectineus. And looking over here on this superior portion of the greater sciatic notch, we have the origin for piriformis. Looking posteriorly now, we have the origins for your hamstrings. So all on this ischial tuberosity, we have the origin for the long head of the biceps femoris and the semitendinosus and the semimembranosus. Also on this more lateral portion of the ischial tuberosity, we have the origin for quadratus femoris. Right here on the ischial tuberosity, we have the origin for gemellus inferior. And then on this ischial spine right here, we have the origin for gemellus superior. Looking inferiorly now, we can see some of the adductors, and inferiorly we have on this ischial tuberosity and wrapping around to the inferior pubic ramus, we have origin for adductor magnus. On this anterior inferior pubic body, we have the origin for adductor longus. And we have two muscles originating on the pubic body and also the inferior pubic ramus. We have adductor brevis and gracilis. And I think that is everything for the ossa coxa. All right, now we're looking at the femur. So we can tell that this is the left femur because we can see that the femoral head points medially, and we can tell that this is the anterior side because on the posterior side we can see this intercondylar notch right here. So we can tell that this is the left femur. Going over some of the origins now, we have the origin for vastus intermedius originating on this anterior and lateral femoral diaphysis. We have the origin for vastus lateralis on this greater trochanter wrapping around to the linea aspera and the lateral femoral diaphysis. We have the origin for vastus medialis on the linea aspera and medial femoral diaphysis right here. We have the origin for biceps femoris short head on the linea aspera and lateral supracondylar line right here. We have the origin for gastrocnemius, the medial head, on this popliteal surface right here, just superior to the medial femoral condyle. We also have the lateral head of the gastrocnemius originating here on the lateral aspect of the lateral femoral condyle. Origin for plantaris is right here on this inferior lateral supracondylar ridge right here. And we also have the origin for popliteus on this lateral femoral condyle. Going over some of the insertions now, looking anteriorly again, on the anterior greater trochanter, we have the insertion for gluteus minimus. On the anterior and lateral greater trochanter, we have the insertion for gluteus medius. On the superior greater trochanter, we have the insertion for piriformis. Looking inside here in this trochanteric fossa, we have the insertion for obturator externus. Looking posteriorly, we can see the intertrochanteric ridge, where on the quadrate tubercle, we have the insertion for quadratus femoris. We can see the lesser trochanter here, which is the insertion for the iliopsoas. We have the gluteal tuberosity here, which is the insertion for gluteus maximus. We have the insertion for adductor magnus here on this linea aspera going down to the medial supracondylar line and also inserting on this adductor tubercle here, adductor magnus. We have the pectineus here originating on the pectineal line. We have adductor brevis here originating on the inferior pectineal line to the superior linea aspera. And lastly, we have adductor longus here originating on the central linea aspera. And that is the femur. All right, so now we're going over the tibia. So we can tell that this is the right tibia because we can see that this is the anterior side. We can see this tibial tuberosity here. And then we can see the medial malleolus here on the inferior side. So we can orientate ourselves and know that this is the right tibia. It's now going over some of the origins. We have the tibialis anterior originating on this lateral superior portion of the tibia. We have the tibialis posterior originating just infralaterally to this soleal line. We have the soleus originating on that soleal line, and then we have flexor digitorum longus originating right here on this medial lateral, or on this medial side, right here. Medial central diaphysis of the tibia. We also have two other muscles originating right here on this lateral condyle, and those are extensor digitorum longus and fibularis longus. Now going over some of the insertions, we have popliteus also originating on this soleal line. We have three muscles originating on the pes anserine, and going over them laterally to medially, we have sartorius, gracilis, and semitendinosus. And we also have semimembranosus originating on this medial posterior tibial condyle. We have vastus medialis originating on this medial tibial tuberosity, and we also have the rest of the quadriceps muscles originating on the tibial tuberosity via the patellar tendon. And then lastly, we have the iliotibial tract, the IT band, originating on this lateral tibial condyle, and that is the tibia.